If you want to walk into your medical school interview having a good understanding of every single NHS hot topic and being able to answer every single question thrown at you, then this is the video for you. In this video, we're going to be looking at NHS mental health services and funding to give you a really good idea of what is included in this topic and the types of questions that you can get so that you can answer them using the content that I'm giving you in this video. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Mental health awareness is a really important issue that needs to be looked at and spoken about in more detail. By increasing awareness, this means that there is less stigma surrounding mental health and more people are able to get support. Many studies have shown that around 1/3 of people could experience mental health problems at some stage in their life, again highlighting the importance of having services readily available for people to use in order to support their mental health. Now, COVID-19 was definitely a time where there was a dip in mental health across a national level, not just for people who were having to be in social isolation, away from their families, couldn't see possibly relatives in hospital, but also for a lot of healthcare professionals, having to work in such a difficult environment, such high stress levels, and caring for patients at such high intensity and volume, and again, the constant concern of being infected with COVID. As a result, a lot of people had a drop in their mental health over COVID-19. Studies have also showed many younger adults, so those aged between 18 to 29, often also had very many negative impact on their negative health due to concerns about being out of university, out of education, or out of employment and jobs. Additionally, children who were in education also faced many difficulties as they were no longer in an interactive environment, no longer with their friends, and often were at home in a much more quieter and what often feels like a more isolating environment, as they didn't have that social interaction element from school, affecting again education, interaction, and also learning. As a result of this, there's been a significant increase in different mental health difficulties that different people may have been experiencing, especially after COVID-19. This has led to more services being required and has actually led to a slight strain on the mental health services because they have a much higher demand. In terms of accessing mental health services for patients, it can often be difficult, again due to the strain that is often placed on mental health services already. This means that getting a bed in a hospital or even just being seen by a mental health care professional can be a lot harder for patients, unfortunately, due to longer waiting times. Additionally, mental health care services for NHS staff too is often difficult. Now, it's really important to address both for NHS staff and for patients that they have access to more healthcare. Additionally, increasing awareness is also really important, as a lot of these groups, they may sometimes actually feel that they're being judged or there is stigma surrounding it. So by increasing awareness within the public too, we can destigmatize any views that are held towards mental health and actually try to support everyone. In order to improve NHS mental health services and ensure that more patients are able to access them when they need to, one thing that has been mentioned in the NHS long-term plan is to increase funding for this. By increasing funding, this means that there can be greater services that are on offer for patients, which means mental health care services can be accessed more easily. Another thing to highlight is that funding for NHS staffers specifically in order to be able to seek mental health services is also planned to be increased too. The topic of mental health often correlates with loads of different areas within healthcare and the world. Some of the ones that we're going to be exploring in this this video include social media, perinatal, and eating disorders. One aspect of mental health that you could discuss in your interviews, or you could even be asked a question on, is the relation between mental health and social media. This is a topic that's often linked a lot, and there's a lot of research ongoing into this. This is because social media, it can be quite damaging to mental health, as it can create a lot of pressure, especially on young adults or even children, because of certain images that they are seeing and that there are certain expectations that are created, or because of the content that they're being exposed to online. The idea of FOMO can also come into play, and as a result, often studies have shown links between worse health outcomes in terms of more distress, more anxiety or depression due to very increased use of social media. Again, if this is something you want to talk about in your interviews, make sure to look at a couple of research articles, as there is a lot of research trying to show correlations and understanding the link between social media usage and mental health. Now let's take a look at perinatal mental health. This refers to a woman who may develop a mental illness or a mental health condition whilst being pregnant or within the first year of having a child. This can happen for many different reasons. For example, a traumatic birth or any other reason, which could lead to one of the most common conditions that women develop is depression. But again, there are loads of different ways that mental health can be affected during this time. Unfortunately, there is no clear specialist route for which women who have just recently had a child or who are pregnant can actually take to improve their mental health or to look after them. So one thing that has been suggested is increasing funding to ensure that there is a specialist service that women who have recently had a child or women who may be struggling with their mental health during pregnancy or after pregnancy can actually use to help support them. Now let's take a look at the link between eating disorders, social media, and mental health. The NHS has stated that in order to help support patients who often suffer from different eating disorders, they'd like to give the opportunity for these patients to have access to different mental health services in order to make sure that they don't still have a negative perception about their self-body image. This is really important in helping these patients, not just in the short term to help make sure that they're staying healthy, but also mentally in order to make sure they actually have long-term health benefits too for their mental health. I hope this video has helped you to have a greater understanding into the NHS mental health services, not just for patients, but also for healthcare professionals, as this is really important too. Additionally, I've spoken about how mental health links to different areas, so you can talk about this in your medical interviews, as mental health is not just restricted to one thing, and it links with so many different things in our daily life, so it's really important to take care of it. Additionally, these are questions or topics that are often linked and come up together in your med school interviews, as you may not be asked just about mental health, but also how it links with other topics such as social media or eating disorders. Don't forget to check out my other videos on my channel too. On there, we look at all of the different NHS hot topics so you can have a good understanding of all of the content to help you do well in your medicine interviews.